Bismillahirrahmanirrahim. Assalamu alaikum rahmatullahi wa barakatuhu. Today we are discussing a young patient who is 19 years old and has a history of road traffic accident. This is CT angiography of the lower limb. We can see this is lower abdominal aorta. Here we have bifurcation, right and left common iliac arteries, area of bifurcation of the both common iliac arteries. This is internal, and here we can see external iliac arteries. Here we see this is the area where it enters into the thigh. This is the area where we can see there is bifurcation of common femoral artery into superficial and deep femoral arteries. We can say it as profunda femoris artery. This is the deep femoral artery or profunda femoral artery. Here we can see this is SFA or superficial femoral artery, while diffuse post-traumatic inflammatory changes are noted around this region. We can compare superficial femoral artery with the deep, and surrounding fat planes are clear on left side. Similarly, we can also compare muscles around femur, and here we can see there is diffuse edema, especially in adductor compartment and along quadriceps muscles. Let's move down. Here we see air pockets are also appreciated. Multiple emphysematous foci. This is adductor canal, and we can see SFA. Here we can see this is fractured site of the lower end of the femur. Mild impression is noted in this upper portion of the popliteal artery because of fractured bony fragments. Anyhow, flow is normal below this region, and here we see there is distal most portion of the popliteal artery, and we can see bifurcation, anterior tibial artery. We can trace this anterior tibial artery, and here there is division. This is posterior tibial artery, and this one is the peroneal artery. Diffuse soft tissue edema is noted in this region. We can compare this with this contralateral left side. Tiny air pockets, posterior tibial, peroneal, and anterior tibial artery. All these arteries can be seen. Tiny air pockets all around with diffuse edema. Because of edema, we see that peroneal artery is compromised in this region. However, flow can be seen both in anterior and posterior tibial arteries. Again, we can see flow in the peroneal artery, anterior and posterior tibial artery. Here there is fracture site of the tibia, diffuse soft tissue edema, anterior and posterior tibial arteries, anterior tibial artery, fracture of the fibula. All three vessels can be noted down into the foot. So we have seen axial images. Now let's see multi-planar reformatting MPR images. These are the coronal images. Here we can see common femoral, SFA, and deep femoral or popliteal artery on this side. Adductor canal region where artery appears normal, and this is the proximal popliteal artery where we can see bony fragments are noted causing mass effect on this portion of the artery. However, flow can be noted below this region, and this is the area of trifurcation. We can see anterior tibial artery, and this is common trunk, and here we see this is posterior tibial artery and peroneal artery. Let's see some 3D deformating. Here we can see this is distal portion of the abdominal aorta, and these are common iliac arteries, internal and external iliac arteries. Here we can see common femoral artery, and this is superficial, and this one is the deep femoral artery. Fracture of the base of the neck, just trochanteric region. Entire course of the femoral artery, and this is the area where we can see fracture of the lower end of the femur. On this portion we see there is mass effect on uppermost portion of the popliteal artery by this displaced end of the femur. This is the area. However, there is normal caliber and flow in the remaining portion of the popliteal artery. Here we can see, and this is the area where mass effect is noted on upper portion of the popliteal artery by fractured displaced bony fragments, but remaining course of the popliteal artery shows normal caliber and flow pattern. This is the posterior portion of the leg, and here we can see distal most portion of the popliteal artery, and this is anterior artery, and this is a common trunk. Here we see this is posterior tibial artery all along down to the level of the ankle, and this one is peroneal artery. Here we can see this is distal, this is the interior view of the leg. We can see distal portion of the popliteal artery, and this is a common trunk. This is anterior tibial artery. This one is posterior tibial artery, and here this is peroneal artery. So in this case we can see there is fracture through the base of the neck of the femur. Head is well within the acetabulum. Fracture is noted just above the intertrochanteric region, and here we see multiple bony fragments are noted in this region. Similarly, there is fracture and posterior displacement of the lower end of the fracture with multiple bony fragments, while we can see fracture with angulation and multiple bony fragments in the shaft of lower portion of the tibia and fibula. So this is an example of the CT angio of the lower limb of a patient with a road traffic accident. Initially we can perform color Doppler examination if there is any suspicion for no flow or limited flow in the leg, and in case of any suspicion of the Doppler, we can proceed with the CT angio or conventional angiography for further assessment before going for any sort of intervention. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuhu.